according to the Professor Park Javo says that the right side of the finger, once you place it, that's to be considered as we all know also to be pericardium. One is the lungs, second one is the spleen and then stomach. The third one is the triple warmer or the pericardium. No, both pericardium. Now the pericardium to be known as a outer covering layer of the heart. At the same time it is brain as well. Professor Park Javo, the Korean philosophy says that Chinese philosophy says is the kidney yang, and then the Korean philosophy says that this is the kidney in. When the kidney in and then yang together, so this is kidney yang belongs to the pericardium, that means is the brain function as well. You remember when the pericardium energy is deficiency, make sure that 100% the patient having the headache. Because the professor said, but I am the student of Professor Park Javo, he is no more, Almighty give him peace and rest in his soul. But he says that I have extracted all the books of the Sujok, then to incorporate it to the acupuncture. So that's what today, this is the pericardium, he said is the brain. Then according to my clinical experience, when the pericardium pulse is deficiency, then the triple warmer pulse is deficiency, then you understand it is purely connected to the central nervous system, the brain and then spinal cord. The brain to be known as a pericardium, then the triple warmer to be known as a spinal cord. When there is a spinal cord problem is there, the cervical brachial syndrome is there, shoulder brachial syndromes are there, that particular time the triple warmer energy is slightly weaker than the normal. When the triple warmer is weak, then make sure the person is getting for the cervical, shoulder and headache as well. When the pericardium is deficiency, then you understand the chronic migraine or the chronic headache which reflected that pericardium is deficiency. So this is in fact is something is amazing. You love to the subject once you thoroughly understand. Then come to the next level on the left side. So this to be considered as the upper geo, the first segment, that to be known as a heart cardiac system. Then come to the next middle level. So middle level is the middle cavity, right? What are the organs? Then the Lian pulse is the fourth segment pulse. Normally the people don't see, but the Lian pulse is the known as a para-orb of the uterus. Para-orb. Or para means is the supportive. Orb means is organs. Para-orb of uterus, I told you. Uterus. What are the uterus inside the organs are there? One is the fallopian tubes, ovaries, right? Endometrium, uterus, inner uterus, right? So all are, there is a passage, the cervix, all are connected to the para-orb of the uterus. Now we try to understand all these levels. Now I repeat, once again, you have to register in your mind that you shouldn't forget hereafter, right? So that should be, always you should keep it in your mind when you wanted to see the pulse diagnosis. So upper segment is the upper cavity. The first segment to be known as the upper cavity. What are the organs are located? Heart and lungs is located. Then the right side is lungs. Left side heart is located. That keep it in our mind. Left side the first segment is heart is located. Then come to the second level, there is a middle cavity, the stomach, spleen, pancreas and then liver is located. Then you understand the right side is stomach and spleen is located, and then left side is liver and gallbladder is located. Then come down to the last level, that to be known as a right side, you assume, don't keep it as a kidney young, perhaps that gets some confusion. Keep it in your mind, that is the brain and spinal cord. That would be better, because I correlated, and then thousands or the lakhs of the people having the same problem, which pericardium and triple warmer having the deficiency. Then that is a proven to me that that's the brain and spinal cord itself. Right? I understand this. Now I'll come to the left hand. The heart is located, and then heart and small intestine both are located, because heart is the supportive to the small intestine. The small intestine is supporting to the heart system. The chi, the shen is regulated by the cardiac system. The essence and then the chi of the energy is promoted to the body as a nutrition supplement through the small intestine. It is interconnected to each other. So therefore the heart and then small intestine is the coupled husband and wife that's connected to the first segment. You come to the second segment, of course, is the gallbladder, and then liver is connected. Both are interconnected. Gallbladder and liver is interconnected. Portal vein is interconnected. Cystic duct and common bile duct is interconnected each other. Then you come to the lower portion of the left hand, that to be considered as the kidneys. The kidneys is in the distal position. You can see the renal system that having the low energy, that indicating the renal system is partially weak. But whenever you see that the kidneys are weak, when the lungs are weak or the liver is weak, and then the other spleen and pancreas is weak, that time you don't say spleen and stomach is weak, that indicating that you have the diabetes. We shouldn't put a word you have the diabetes. Of course, by looking itself we understand the patient is diabetes or the non-diabetic. Of course, if the patient is telling the diabetes, of course is diabetes only. So however, when the person is coming to you, non-diabetic patient, that particular time you are telling that the spleen pulse is deficiency, SP pulse. SP is indicating the spleen and pancreas together. When that is deficiency, that particular time instantly we shouldn't say that you have the problem of the spleen deficiency. Perhaps no, you are the diabetes. Telling like that is not so good. You understand? When the liver, if he do have, you just put a word. When you cross check, how is your diabetes is under control? The way politely you just ask them. He don't have, he says, I don't have. Then nothing, but you say there is a metabolic disorder is there, the food metabolism is not taken place. When the muscular system having the deficiency, the muscles having the flaccid, that reflecting that spleen is deficiency. You just put a word, this is the problem, right? Then you come to the liver. When the liver pulse is deficiency, then please don't mention that liver is weak. You just say, sir, perhaps fatty liver you may have. Today is the common. You just mention, that will not cause much problem. But when you say liver got weak, today you know the transplantation of the liver, transplantation of the kidney, how is super simple or super expensive, or donating liver or kidneys is not super simple. No one is giving that. Then the life itself is a failure. Then you wanted to make them to that level, or you are telling that liver is weak. But instantly, immediately, he rushed to the investigation laboratories to do the sonology report. Then he says the kidneys are normal. Then how you can say my kidneys are weak? That's the reason. Pulse diagnosis, that's what I told you. You know the theoretical part and philosophical part. How to tackle with the patient also is the key. What is required to them? How politely you just take to them, that's imperative. So however you understand, now then we understand about now I am coming to some advanced and classical level. Basic you understand. Now, the large intestine is not located on the large intestine pulse, by the way, for your information, but small intestine is not located on the first pulse, but that is there somewhere else. Fu means is the yang viscera. Always certain words, keep it in your mind, okay? The fu viscera means is the yang organs that all are connected to the third position, not on the first position. That means I am not making you confusion, and some of the students are advanced students, I think some of the doctors also. For them is the recognition that the para or which I told you, intestines are located on the triple warmer region, the intestines are located on the urinary bladder region. Where the UB pulse is there, that pulse also to be considered as the intestine pulse. When the triple warmer is deficiency, make sure you just put a word, sir, you do have the bowel irregularities. Then he said, absolutely right. But that's there in the first pulse. But always when the triple warmer is deficiency, the most of the time I predicted 99% the patient says, yes, I do have the constipation if the if the triple warmer pulse is deficiency. That is the third pulse. When the urinary bladder is deficiency, UB pulse is the third pulse. If it is deficiency, then you understand UB pulse is not only the UB pulse, of course is the UB pulse, at the same time which is the mother for the UB is the mother is the colon also affected on that region. The large intestine also located on this region. If you cannot see the pulse in this region, then there is the large intestine deficiency. Large intestine deficiency, perhaps you do have the diarrhea or the dysentery. Diarrhea normally it happens because of the cold conditions of the colon, not the totally heat constitution. Few conditions, chances are there heat, but the diarrhea normally gets because of the cold excessiveness in the colon. So that is only related to the chest. That means the Tan Chang, there is the name itself. The first pulse of the right side, there is the name itself. One is the Tian Tu. Exactly you wanted to know, I'll tell you. Tian Tu. Tian Tu means Ren 22. And then Shenzang. This midway between these two, the Chinese name known as a Tian Chung. Tian Chung means is the chest. Only that it's representing to the chest only. That means is the lungs on the right side. No intestines on that region. But however, there is the beliefs that thousands of years ago, this has been derived the pulse diagnosis. The people is recognized the large intestine, but however the large intestine pulse also you assume because the lungs are corresponding, the lungs are communicating, the lungs is meeting to the colon as well. The lungs pushes the energy to the downward direction and receiving by the two organs. One is the liver, kidneys, the second one is the colon. So therefore you predict that there is no large intestine here. Sometimes you wanted to accept that large intestine, also you just accept that also correlating to the large intestine as well according to my clinical experience. But however, see, according to the lower geo, this is the first segment, is the first segment. This is the chest cavity. This is the middle cavity, middle organs. Where the intestines are located, where the uterus is located, where the urinary bladder is located, where the vaginal and then penile organs are located on the lower geo. Then you try to find out the lower geo itself is the place where all the lower extremities are existing on the third segment and then fourth segment.
We should consider as a small intestine and large intestine is in the
third position.
And even UP.
But according to the theoretical part and according to the science, but that is the left side is small intestine, right side is the large intestine. You also accept that. Sir, you are making us as the dilemma. It's not dilemma. See, in the preliminary level, you don't want. But you people are studying is the advanced level, and with me and you should always advance, right? So therefore you learn something. There is no textbooks has not written what your mind says. What I am also kind of the author. So author means I to understand many philosophies by studying the so many philosophies. What is my own philosophy? But this is in fact according to the clinical experience. You understand the lower geo, which I divided my whole body, heaven, human, earth. Then this is the lower portion also to be considered as a is the lower geo organs, accept it, but at the same time I can see to the patient if the lower geo having the problem, of course intestine also having the problems. What is wrong in that? If you are predicting that, you are understanding that the lower geo is intestine, also we cross check with the patient, definitely you will get the answer. Now we understand, aankh band karke, then you keep it in your mind, this pulse is upper geo, the second pulse is the middle geo, the third one is the lower geo. Come with me, come on with me. The first positions are upper geo. What are the, loudly say, what are the organs are located? Yeah, tell me, randomly tell me. Upper organs, upper geo organs? Wonderful. The middle geo, middle organs? No, wonderful. The lower geo? And intestines. And intestines. Till the foot is the lower geo. So therefore now we understand basically the first position. Now I wanted to correlate something is connected to the each organs. Now the first position is the lungs. Now you just feel that there is another modality of the diagnosis. Each and every organ cannot exist without the support of the other organ. As I told you a couple of times, husband is there, wife should be there. Wife is there, husband should be there. Sun is there, moon should be there. Day is there, night should be there. Inside is there, outside should be there. Brightness is there, darkness should be there. Right? So everything is, the software is there, hardware should be there. Light is there, brightness also is there, darkness should be there. Right? So therefore each and everything in this universe, the positive is there, negative should be there. Systolic is there, diastolic blood pressure should be there. Thyroid is hypothyroid and hyperthyroid. Hypertension and then hypotension. Negative and then positive. Right? So the success and then failure. True, false. So everything should be equally required. Yin and yang. Yes. Zhang and Fu. Right? So now we understand about the concept of the yin and yang here, but now there is the each and every organ corresponding to some other organ. One organ cannot exist without the support of the organ. So therefore the yin connecting to the yang. That means I am the yang and you are the yin. Right? So yin and yang, male and then female, together, joining together itself is the purpose of the life. You wanted to destroy and eradicate the human system or the population, then you don't get marriage forever. And if no one is getting the marriage, then 140 crores, and another after 10 years also 140 crores population in India itself. Right? So you understand, joining together is the life. Right? So therefore only the male and female created. So now in this way, the first pulse to be lungs, then the lungs is connecting to the large intestine. The lungs is receiving the energy. That's supplying to the colon as well. There is a very big science. When I take the preliminary classes, that time I'll teach you how the lungs and large intestine interconnected each other. The oxygen is going inwards and then the carbon dioxide is going outward, and also the colon, the nitrogenous oxide is passing through the colon also. So there is a interconnected each other. So in the similar way, the first pulse to be known as the The first pulse to be known as a large intestine, the second pulse to be known as a deep pulse. But when we'll take the practical, that time you understand many concepts. Now there is another concept is known as a Tumai and then Renmai pulse. This something is new, the Tumai and then Renmai, because all the meridians are existing. In that there are the another two meridians, which is the ventral side of the body, the other one is the dorsal side of the body, and both the meridians are existing. The right side, the first point, where exactly this is the belly of the muscle, the thenar eminence muscles. So just you come to the palm muscles downwards and not the crease, above the crease. Above the crease you can find the pulse to be known as a, that is the Renmai pulse or the Renmai location. At the same time, this is the especially on the left side, just come from the belly downwards direction, you can find the pulse to be known as a, that is on the Tumai pulse. The Renmai and then Tumai are the two different meridians which is existing in our body system. When these two is joining together, that is the purpose of the life. Tumai and Renmai is joining together is the life. So therefore, I wanted to give you as the crispy way, there are the 5 points in our body to regulate the top to down, that will be useful for the all the diseases in generally. The 1 point to be known as a Li Chu, Sao Hai, Huxi, Shen Mai and then Yang Ling Chuan. 5 points you keep it in your mind. LU7, K6, SI3, UB62 and then GB34. Now you understand this is the Renmai meridian. This meridian to be known as a Renmai meridian, right? This meridian to be known as a zero meridian or the Dumai meridian or the governing vessel meridian. When this is the ventral side of the body is good, then this also good, but however this also good, Dumai meridian, both the meridians are functioning precisely. Then this side is good, all the internal organs are good. When this is good, then the whole spine and muscles are good, right? Upper geo, middle geo, lower geo, all are connected to this two. Now there is a sideways, there is a one meridian is there. That meridian is Fellal meridian or the gallbladder meridian, isn't it? So these side meridians are, this is symmetrical. So it starts from the temples and then it crosses and entire side of the body, the energy is flowing till the fourth toe. If that side of the body to be regulated, the super powerful point on the gallbladder meridian, that point to be known as a GB34 is the Ha-Si point. That means is the great powerful point on the gallbladder meridian. Numerous points are there. The most influential point for the muscular system and also tendinomuscular system to be regulated by activating the one particular point, that is Ha-Si point. The pen shoe is the play, there is a name, there are the, according to the pen shoe, the energy starts from the one meridian to the one point to the other point. This is Ha-Si point. When the seniors are there, they understand the energy starts from the Putial or the Jingwell. From the Jingwell, the energy goes to the Ing spring. From the Ing spring, the energy moves to the Shu stream. From the Shu stream, the energy goes to the Ching river. From the Ching river, the energy goes to the Ha-Si. Si. Ha means is the sea. I am mixing Chinese and then Indian, both are mixing together. I am talking to you. One is the ching means is the well. Well, from the well, it energy passes to the spring. From the spring, the energy passes to the stream. From the stream, the energy passes to the river. From the river, energy passing. Ultimately, the whole river water, where it goes? Sea. So therefore, the sea energy is the great energy. Therefore, GB34, the point is located the anterior and inferior to the head of the fibula. That particular point is amazing point. Once the LU7, K6, SI3, UB62, it protecting to the anterior side of the body, and then is the ventral side of the body. The another point is the GB34. Professors, important point. He liked this point is too much to apply for the maximum patients. But GB34 is my clinical experience because it is the lateral side of the body meridian also governing by this particular point. So therefore, the ventral dorsal, if you know the disease, you may not know the disease, or irrespective of the disease, then you wanted to treat this, certainly you can select 5 points in your mind. You are not understanding what kind of the disease, from the common cold to cancer, from the common fever to the paralysis, you can activate these points, certainly having the great impact. But you are wanted to ask me, how can you say, but these are the 5 points are applicable for any kind of the diseases. You can arise the question, any question related to the any kind of the disease, but I can give you the answer for you that how is it connected, these points or that particular illness. There is an answer, but however, with closing your eyes is not recommended to apply this needle. Sir told me this is the pancha bhuta points. This something is good. All the points, these 5 points to be treatable. Of course, I have the faith on it, but certainly Almighty give the chance to get relief to the patient. With heartedly, you focus and treat the patients. Because this is the martial art points. This is not the points of the common acupuncture points. Every martial art where he is chopping, you understand that places itself is these points only. He is chopping. That's called as is the martial art. That means is something is collapsing point to the body system. Sir, what sir you are making to collapse the patient? Absolutely no, to survival. Martial art is not to kill the person, to defensive mechanism, protective mechanism, required. Now let me see, the pulse taking is the posture of the practitioner. I think this I will do that as a practical section. But however, you can see when we wanted to see the patient should sit always in front of you, not in the sideways, not in the somewhere else, not on the standing level, not on the sleeping level. That should be precisely sit directly next to you. That always is good, right? So later we'll do that practical. The later, how to diagnose for the self healing to be taken place. 2 things here. One, if I am sick, shouldn't happen that, by the way. So if I sick, then I wanted to take the treatment myself, then I can do that procedure. Then I don't want to take the treatment myself, I wanted to go and take the treatment with my wife, right? So that particular time I should surrender myself to her to diagnose and treat me. This is the key, keep it in. Now I am the professor, acupuncture super specialist, everything forget about it. What she says, I should listen. What she treat, I should accept and then take it, right? So that is the faith we have to keep it. When you are going to somewhere else, no, if you just put this needle, you just put this needle. So this is in fact is not so good, but of course my professor says sometimes you put this needle I accept and I need to do it. But however, when we are in the sick position, always we should surrender our living body, not as a body, then we should take the treatment. So when we are in the sick and no one is there in that particular situation, I wanted to take the treatment. So that particular time, analyze. Now here is in the this we are placed like this. This in fact is the wrong. So how to do that procedure? Always you remember, place your fingers itself is placed on the other hand. Now I wanted to use the right radial pulse, right hand, by using the left hand. Now 3 fingers is the very sensitive fingers. This is the first finger, this is the second finger, this is the third finger. Right? Place 3 fingers in this direction. Thumb is here. My thumb is here. Then I place 3 fingers like this and try to find out which pulse is deficiency. Sorry? Yes. So now we understand, in this way you can see. Now I can show you this. This is the wrist. You place the 3 fingers like this. This is the first segment, the second segment, the Chun, Kwan, Sh, 3 pulses. Always in this modality is good to identify the pulses. Now you are placing like this. In fact, this is not the proper position to identify the pulses. So this time when you are the expert, then you understand which organ, because you know which timings will be good. Morning will be good. After the urine passing, after the bowel elimination is the right time to find out the pulses precisely. So that particular time you analyze which pulse is deficiency, then note down, yes, this is the pulse is weak, and then again you can see under this modality, then place it 3 fingers together. This is always is good. Once place it like this, 1, 2, 3 pulses, and then 3 pulses together, and try to see the surface pulses. Then again you just see the 3 surface pulses. All 3 are popping it, and then pulsation I can feel it, and then you just go down, and then the last pulse, deep pulses also is pulsating normal, then it to be considered as a normal. But my beats are slightly rapid, accelerated. It's indicating slightly excessive heat in my body, which causing me something is popping more. Because last night only through the journey I came from the different state. So now we understand this is one thing. This is the second thing, is the placing the fingers. So this is identification. How to practice this? This is the key. You practice in 2 ways. Practicing yourself and practicing to the others. This making you both are perfect. Right? So in this case I am not telling you to get sick immediately and then take analyzing. But normal rhythm we wanted to see ourselves is always is good. Right? I'll repeat once again. When you are seeing in the early morning pulse, so that particular time we wanted to see all the 12 pulses. But overall we should see 18 pulses plus 4, 22 pulses you can see in the radial artery. There is no system of the medicine in the world except acupuncture. On the radial artery we see 22 different pulses. But if I am not wrong, at least 18 plus 2, 20 pulses at any cost we see in the radial artery. During that particular perception, we try to 3 organs to focus. The UB pulse, it shows slightly weaker than the normal, that to be considered as a normal only. When we understand the large intestine pulse is slightly weaker than the normal, that to be considered as a normal only. When the stomach pulse shows, then it's slightly weaker or normal, or it is depleted, that also to be considered as slightly given the higher marks to them. Normally you understand there is a 10 marks. 10 means is the 100 marks. In that the pulse position is showing around 50% is the normal, then the 50% means it is 100% is normal. Because just now you eliminated the bladder, just now you evacuated the stools, Then by the way, when these two organs or lower organs are weak, then the upper organ is empty, that indicating that the stomach also feel empty or vacuity, or there is the no energy because feeling the hungry. So that particular time the stomach energy is weak, we cannot consider that. That to be given as a additional marks to them. If it's slightly getting the pulse, slightly feeling the pulse, that indicating yes, that pulse is absolutely normal until they don't have any pathology. So therefore, when seeing that particular time your bladder is weak, your intestine is weak, your stomach is weak, we shouldn't say. If it's slightly is there, yes, absolutely it is totally weak is there, then we understand, yes, partially weakness. So in that way, when the patient is normally, in these days, what we are practicing is at least every day 12 hours fasting is good for our health. In every year, 30 days to 40 days fasting is always is good. 20 to 40 days. 20 to 30 days also not bad. But of course, again it is the respective related to religion as well. But however, keeping the fasting is not to God, keeping the fasting is good for ourselves. So that's the reason he kept to do the face the fasting. So in this case, when the stomach is 12 hours, you haven't taken anything, that in fact after that you are seeing the pulse, that particular moment, of course the stomach pulse is slightly weaker, spleen pulse is slightly weaker than the normal, that to be known as a normal pulse. Right, make sure that all of us hereafter, we try to keep 12 hours fasting every day. We eat at 8 o'clock or 9 o'clock or 10 o'clock in the night, so better as much early we are taking the food, that much is good. Then you keep it that 12 hours is, you shouldn't take anything except water. Right, especially for you, okay. Good. Then the morning is the right time to see the pulses. So here is, in fact, if the patient is not unable to come on that particular time, normally I start practice at 11 o'clock, then 11 o'clock is the not, no, that's the right time. But however, that particular time patient is coming, that also I can add up that when there is the stomach already, he filled the breakfast, enough breakfast, that time it is pop-upping the stomach pulses is super pulse, so that I indicate is not the retention. It is normal, right? So in this way we try to predict all the things, of course, before putting and telling to somebody else. So therefore now we understand about the pulse position is, especially there are the few positions, so we shouldn't take it as a account. Now the distance between when we are placing in between the fingers to the patient, so that particular time the many people may come, like I've forgotten your name, sorry, Abdul Subhan. Now if I wanted to see his pulses, but I cannot use as a 0.75 inches, but I need to use as a 1 inch for the each pulse, because his height is 6 feet, more than 6. Then my height is, I shouldn't say, don't ask me. Then you understand, so my fingers are the shorter than him. His diameter and then his length is the tunometer. Once we wanted to see the analysis of the tunes, and his measurement is slightly larger, then that to be considered as I need to keep it not the 1 paper distance in between each finger, but I need to extend, that is the 1 tune or 1 inch or the 23 mm. Then I just see the each and every pulse. At the same time, when the person is coming like my age and then my height and weight, and then of course is the girls or the women is coming in the same level, definitely I can place it is the 1 finger is the same depth, I can place it one by one. When the children are coming or the infant is coming to us, so that particular time we need to place is the 0.75 tune is the 1 finger. Absolutely no. Then I need to minimize. There is a very small place. In that small destination, I need to divide it into 3 divisions. You can place as the pinky finger and then find out. Place the pinky finger on the second division and find out the third is pinky finger. So I am treating to the 6 months old child and then 1 year old child. So I cannot use. So as my big finger, I just place it is a very small pinky fingers. But make sure the person who have the numbness in the fingers, and you shouldn't place. Right? You don't feel, by the way. So wherever it is the sensitiveness is there, where you can feel the touching sensation is there, so that sensation fingers you can place it. By the way, there are the 1 finger you wanted to place, or the 2 fingers, or the 3 fingers, or the 4 fingers you wanted to place, you can place it. But which is the more sensitive, that means palpation, you can feel that yes, there is the belly of the finger, or there is the knuckle of the finger. So where there is the fishy type of the place is there, that we have to place it to understand the feeling of the pulse. When I take the Ayurveda kind of the pulses, there are the 3 types of the pulses are there in VKP. That means Vata, Pitta, Kapha. Then the Vata is related to all the wind related disorders, the pain related disorders, that to be considered as there is a movement of the cobra. How the cobra, the snake is moving in that direction, the energy, the chi also moves, or the pulse get movements. So that to be considered as a Vata. Then we wanted to see the second pulse is the Kwan pulse. Then we understand this particular region. Now this is kind of the frog pulse or the Manduka pulse. How the Manduka is jumping each place. So that means the pulse also get jumps, high jumps like this. So that to be considered as a kapha or the heat syndromes. Then the third position to be known as a shear pulse. That pulse is, in fact, is the flowing of the water. How the swan is passing on the water, it's moving smoothly, enjoying on the water. How the water, she's not swimming, but it's the water is taking wherever it is required on the same pathway, right? Once need to place it, the swan on the water, how that is swimming slowly, that moves with the wings, and in that way the patient feels some kind of the inside water is flowing. That kind of the flowing is nothing but is the kapha pulse. Vata, Pitta, Kapha is the three doshas. So either you see on the right side or left side, only mostly three types of the pulses. So that also, when the pulse is giving the confusion for the TCM acupuncture, that time try to find out according to the Ayurveda pulses as well, whether it is the cobra pulse or the snake pulse, or it is the frog pulse or the manduka pulse, or there is a swan pulse, is the moving and swimming on the water, floating. Then you understand you are the kapha person, then you understand you are the pitta person, then you understand you are the wind person. The wind is nothing but is the vayu person. Vayu is indicating here, of course, is the liver is connected to this, metal is connected to this, then the liver and metal both are connected to this. You have the related problem connecting to the joints pain, of course, is the wandering pain, musculoskeletal disorders, of course, at the same time is the GIT, and then pulmonary system disorders. When you come to the manduka pulse, you can find that liver and gallbladder here also is the position. At the same time, pitta get excessiveness. Pitta is getting excessiveness, liver and gallbladder, heart also included here. So therefore you try to understand, yes, this also could be the reason where excessive the bile is, secretion is more, which causing you the headache, which causing you the vision related problem, burning sensation, and also there is a pain sometimes. At the same time the metabolic disorders as well. Spleen also connected to this. When you come to the lower portion is swan pulse, that to be considered as a, there is a kidney pulse, and then of course is a spleen pulse also included in the kapha. So that particular situation where the patient feel lot of phlegm accumulation, especially is the cold phlegm or the white color phlegm or the green color phlegm is get accumulated. The phlegm is again divided into two. One is we can see, that is the phlegm. Where you can't see, there is another phlegm, where that phlegm is accumulated anywhere in the body. In the uterus there is a phlegm, in the fallopian tubes there is a phlegm. There's nothing but is the fibroid or the cyst. And there is a fibrocystic nodule, which we call as a ganglion, also one kind of the phlegm which is accumulated on the dorsal wrist, right? And also any kind of the lipoma or nodules which is communicating inside the skin, that also kind of the insubstantial phlegm. All are internally connected to the cold conditions which is related to the kidney and then spleen as well. Now infantile, you have seen the pressing strength. The doctor should put the different strength on the fingers to feel the different positions. At the same time, once you palpate the pulse, that particular time you understand, abhi aapne pata chala, you have taken out. Once you see the pulse beat, then immediately you are taken off. So it says that, actually the authors write that, or the some people, professors believes that, so nearly 30 to 60 beats should be shown in one single pulse. There are so many theories are there, 30 seconds for the diagnosis and 30 seconds for the treatment. So this also we know that. But some authors says that you may require 30 to 60 pulse beats are required on the each respective pulse. Then you understand how much time it will take to understand, because there is a rhythm, force, tension, volume, quality that should be is the properly is there or not there to identify the each and every pulse. That takes is the longer duration. So once we understand, once you place it on the one particular place, then place the hand in the same position until you will get the 30 pulse beats to get the accuracy of that particular organ. Is it possible so? Yes, it's possible. Of course, many patients are there, that time we cannot sit for the longer intervals to predict that. But however, according to my experience, around at least 10 beats. If it is not at least 3 beats per pulse. You place your hand, is the one hand is, one pulse is showing 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. In the same rhythm, then it's okay. Same rhythm, that means it's the same heartbeat, without any changes, that's happening for 10 times, then that pulse is absolutely normal. Because why should see for the 30 pulse beats? If any barrier in between the blood vessels, if any problem in between the internal organs, that will reflect in our body on the radial artery. There is the heartbeats are irregular. Beats are coming and beats are dispersing. The beats are showing, then slipping sometime, and you can't see that pulse. So that particular time, the movement of the chi, the movement of the blood, the movement of the fluids is not perfectly correct in the internal organ, which is reflecting here. That's the reason it is recommended to see at least 30 times. If you can't do it, at least you just maintain for 10 times. If you can't do it, but sometimes is minimum I see 3 to 5 times. If there is a irregular heartbeat is there, then you understand that organ having the malfunction. Especially the cardiac system and then renal system, you just see if the beats are irregular, it's coming and it's dispersing. Otherwise, it's coming in one rhythm. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. You can see the gap. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Which is missing? In between the third, fourth and sixth is missing. So indicating that that is the insufficient blood flow or the improper blood flow is not passing to that particular organ, or the oxygenated blood is not quite enough. There is a meridian or the channel or the chinglo or the network or the collateral is getting obstruction anywhere. That causing the problem. Try to correct it. What to be done if it is less this kind of the beats? That's the reason. That I'll tell you the solution for that. But however, if it is weak in this way, then you understand these irregular beats of the large intestine or stomach or liver or kidney or the heart. You just record it. Then you just reapply the treatment. You just give it to them. Again, you just see there is the flow is good. The sixth interval it has been not coming the pulse. Then the sixth time is coming the pulse or not. Recheck it again. This is the research.
After the treatment, sir?
Yes. You understand? So normal rhythms, how to understand? What is the beats to be normal, especially is there in our body. You understand? For the normal human being, around we know the 72 beats per minute is there is registered. But however, 60 to 90 beats also to be considered as a normal. Keep it in your mind. 60 beats to the 90 beats per minute. So how to see this? Watch. So you just take the watch, all of you just take off that, place it in your hand, which having the seconds, if you wanted to see, then you just try to see that, place it here, and then where the 12th place where it starts as a seconds, 1, 2, 3, 4, 5, like that. You just calculate from 1 to 15 seconds. From 1 to 15 seconds, the 15 beats should be there. 15 into 4, how much? 60. Right. If it is 20 beats for 15 seconds, then totally 80 pulses. Right. If it is the 80 pulses are there, then that to be considered as a absolutely normal. This the rhythm keep on to reading with your watch. With the seconds watch is required, you just place your finger, try to find out how many seconds for 15 seconds, how many beats for 15 seconds. Yes or no? You will practice, all of you?
Yes, sir.
Really? You will start from today? See, this takes decades together, professor said, but in this case, you shouldn't be hurry that I wanted to learn today. But of course, I am giving you as information, this keep practicing forever to become the expert in the later stage. So therefore, you start seeing that first to analyze the normal rhythm of the pulse. How the quality of the pulse. See, you are taking one vehicle, car or bike or scooter, then you are going on the road. So the road is absolutely normal. In that case, in the one frequency you have to go. For example, you start from the Hebal to the airport, right? It is not much vehicles. So one flow you are going, that flow is going to understand what level is the very good, around 30 speed, 40 speed, 60 speed or 80 speed. So that same level how I should go, then the same way how your rhythm is happening inside your body system. If it is 60 beats per minute is your body is normal, or the 80 beats in our body is normal, or the 90 beats, then check with all of them. The space midway between, normally I place the finger, I can understand there is the hypo or the hyper pulse, the cold pulse or the heat pulse, the hot nature or the cold nature. The required is the cold element is affected or the hot element is affected, the fire element. Once we place the hand, normally I place the hand is, मैं यहाँ पे नहीं रखता हूँ, I just hold the wrist. I hold the wrist of the patient initially to understand the inner temperature of the ventral side of the wrist. It's not I don't have the desire to hold the hand of the patient, just to analyze. So once we place it, that itself we understand. Once the beats is there, that beat it gives the information is the hypo or the hyper. To recognize and understand it takes the time. So that's the reason everybody, all of us, we need to focus and analyze that what is the normal person's beat, what is the hyperpyrexia beats. That means when the person is coming for the temperature, that particular time the beats are rapid. Normally 60 to 90 I told, but they do have 120 beats per minute. Once you place, you have the temperature. Once you place, we say you have the heat constitution of the body. When we try to find out, is a very slow pulse and it is very deep pulse, I need to find out. I couldn't see anywhere that indicating that the slow pulse is there. The slow pulse is indicating that somewhere is affected is the cold syndrome. What is required? Yin is dominating, yang is very deficiency. Yang activate, and yang activate, yin to be diminished. Reduce the cold and increase the heat, and so on and vice versa. You understand? So therefore always it is required. The infant is coming to you that particular time. Try to understand at the time of the birth the child is coming to you. Then you understand you have the temperature. Despite of that the pulse beat is 140 per minute. Infant normal heartbeat is 120 to 140 beats per minute is normal, not the hyperpyrexia, not the tachycardia. Tachycardia is excessive heart rate to be known as a tachycardia, whereas in the bradycardia is nothing but is the less heartbeats in the heart. Do you know the hypotension and then hypertension? Or that also it is relevant to this. When the person having the normal heartbeat, that means is the hypotension patient is there, that to be considered as a 110 by 70. That is considered as a normal for that human being. That normal to that girl or woman or boy or man. That cannot be predicted that you have the hypo. That means is the less heartbeat is there. That means due to that reason, the 60 to 70 or 60 to 65 beats per minute, for him it is absolutely normal. The person who having the BP is 140 by 90, but that also cannot be considered as a hypertension. For them the 90 pulse beat is there, that also normal healthy person for him, but that to be considered as a normal for him or her. That cannot be taken as accountable that they do have the bradycardia or tachycardia. So in this case we understand when the infant or the children are coming, so that particular time is the thud 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 lub dub lub dub lub dub lub dub sounds are coming through the stethoscope. When we shouldn't say that, oh, kuch ho gaya hai, it's going to happen, that so heart will going to burst now, right? We shouldn't feel like that. First we try to analyze with the pulse is reading, and then one place it on a stethoscope within you, not putting on the neck region and showing the bandhas that I am the professional doctor. Don't do like that. But however, you wanted to understand about the pulse through the fingers, at the same time through the stethoscope you wanted to do it place on the chest cavity. There are the 4 places you have to place it, the chest, that is on the, especially on the chest region. When we do the clinical practicals or the clinical methods, that time Dr. Anis Fatima will tell you where you need to place on the 4 places on the chest. Stethoscope you wanted to place anywhere is okay. You wanted to see the lungs, that is the different. You wanted to see the heart, that is the different, right? So definitely she will going to take care of that. Now the children is coming 90 to 100 beats per minute. You understand that adults is 60 to 90 beats also to be considered as a normal. When the person is coming less than 60 beats per minute, that to be considered as a slow pulse, weak pulse, right? So now we understand there is the slow pulse is there indicating the deficiency of the chi in the yang. Now the person is coming 100 beats per minute. 100 beats per minute, you can consider you do have the excessive heat syndrome in your body, but by the way you don't have the temperature. If there is no temperature, the pulse rate is showing 100 beats per minute. When he do have the palpitation or he don't have, please check down. Palpitation is there, that's the reason his heartbeat is more. No, because of the excessive heat in the colon, excessive heat in the stomach and there is spleen, which is reflecting is the excessive heartbeat, because the ascending energy goes upward direction, which reflect the excessive heat, or the heartbeat will be more. When the person doesn't sleep for 6 hours at night and the daytime 30 minutes is taking the nap, is a very important to each and every human being. But they don't do that. Then that also causes that the person knows that I sleep only for 3 hours at night, then I don't sleep at all, but by the way I am active. For that person 100 pulse beat is normal. Right? So in this way, so many things we need to analyze and understand. When you are seeing the pulse diagnosis, first we need to understand about the rhythm, and then is the way of the frequency of the pulse is very important. For that's the reason what is required. Start seeing today, at least 1 year, you have the great experience that particular time. So then you understand, once the pulse diagnosis, once keep it in your mind, there is a solution also will be super simple. The solution, once your diagnosis is over, then what will be the outcome and treatment to be given. So that once you understand these 2 concepts, you will be the loving person to the system. Then you will get the satisfaction and gratification yourself to your heart. Then if you are feeling good, then definitely the patient also feel happy. Then you are in the dilemma, the patient always in dilemma. Then the seasonal pulse also it get differs. The summer and autumn season, the floating and choppy pulses you can see. Winter and then spring season you can see the deep and then slippery pulses. Especially in the summer season and the autumn season, that pulse is always on the skin surface level, because more energy. What is required? Why I am using as a red blazer? Today I am taking the pulse diagnosis. The pulse diagnosis belongs to the heart, is the blood vessel. Blood belongs to the nature of the red, is the circulation. That circulation also should process in my heart precisely more than, because my red color is indicating that I am taking to the pulse diagnosis related to the arteries of the blood, right? So therefore, when the summer season and then autumn season, always that reflecting on the surface level, the treatment also to be given on the surface level, not to the deeper level. When on the winter season and then spring season, so this both the seasons are the energies are existing to the deeper level, not on the skin surface level. Because when the person is very active on the young nature, when the person is very sleepy in the cold nature, the person wanted to wake up in 6 hours, but the patient is not. The person is wake up in the morning at least after 6 or 7 hours, 8 hours. Again he wanted to take that sleep. Nahin? So और कंबल ओढ़ के सो जाओ. So they feel that. Why is it so? There is a more in is there outside, because that's supporting. The nature is always, I love to the nature, I respect to the nature, I respect to the Pancha Mahabhutas. God has been created that environment across the globe. Wherever you go, that kind of the people are, when I was very fascinating to see the Ooty, Udagamandalam, then in that particular place, the broccoli is more, cultivation is going on. So that particular time, the people have the more broccoli is a fresh vegetable for them, because the nature of the broccoli, you can see, the cold nature people will affect it, the cold especially for the pulmonary system, lungs are getting affected. The God has given the lungs, same kind of the lungs, all alveoli, brachioles, how the inside the lungs are there, the same concept is there in broccoli. So broccoli is very good for the pulmonary system, lungs. Therefore, they shouldn't get affected. That's the reason more quality. Even I like here. I'll take 120, 150 rupees I'll give per kg. I love that taste. I buy it as a vegetable for our house. You understand? Because it's not cultivating here, because this nature is better than the Ooty. Right? The temperature is normal temperature we can see here. But in this way, the God environment made that in that way. So wherever the people are living, I came to know when I was visited to the various states and countries, that particular time in India, you can see around hardly it will take for 3 minutes or the 5 minutes or the 10 minutes walkable, but they cannot come to the one place to other place. They have to come through the helicopter. For the 10 minutes destination from here to here. The people are living here and the people are living here. The destination is only 10 minutes to walk, but they cannot walk. If wanted to migrate or I wanted to anything distribute from here to here, through the helicopter should go to give something for them. In India, how places are existing, but for them what is required? For them what is required? They are not coming each other, because we are one place to other place for the sake of the food or sake of the, to gain our life. But here the people are living in the same place, they are not moving, still God is giving everything for them. Vicinity of that area, they do the cultivation and they do eat and they are healthy as well. You look at the deserts or somewhere is where exactly there is no water at all in that particular place. For them also living happily, of course with a healthy way. So in the similar way, seasons will get impacted to the human system according to the seasons, according to the climates. This is the wind, dampness, dryness, coldness, humidity. All are connected to this. These are the friends. At the same time, these are the evils as well. If the winter has gone in the February, but now we are getting the impacted on our skin. That impact is reflecting now in the month of March. Not you and me, but the entire animals, living things are affecting this system to the living things. In the similar way, whenever we wanted to do this, why I mean to say, when there is a superficial treatment to be given on the summer and then spring season, and then the deep treatment to be given during the winter and then spring season. That's what everything it matters. The disease can be divided into based on the seasons as well. The seasonal medicines are there, seasonal diseases are there, and you have heard about it. Now is the doctor's season. Doctors are very busy because of the patients are very full for the flu symptoms or the common cold or so on. In the winter seasons, or the people are very prominent to get one or other related, or the summer season diseases are different. So therefore, we analyze what kind of the diseases are reflecting on particular season. Based on that, we also try to analyze and keep it in our mind what kind of the treatment and modalities to be incorporated. Whether the heat treatment is required, or the TDP lamp is required, or the moxibustion is required, or the cold treatment or cryopuncture is required, or the ice therapy is required. So something is, we need to keep it in our mind. Yes, the problem is in this 3 months, the patient will get this set of the patients, and we wanted to be prepared that kind of the solutions to be given to them. Yes or no? So now the pathological and morbid pulses. This is something is, in fact, I'll try to wind up today will be the theoretical class, and most probably next week I'll take you as a special class for the practical, that you will going to learn, all of we learn about the practical section, hope so. Then there are the something is connected to the abnormal pulse, I don't believe it. Sir, you are the master, you are telling you don't believe in the pulses. Of course, what to do is the didactic errors, the teaching errors is there. I do teach, but I do mistakes as well, because the pulse diagnosis is not expert by anyone. At the same time, the pulses 32 different types of the pulses. One pulse you can't see in your own across the age. In the entire age you can't see one pulse. How the star is coming, one star on the sky after 250 years. You can see that star, all the people can see that stars? Yes or no? We can't see it. That's coming 250 years. God not given for 70, 80 years. Then where we can see that star? Of course, that particular time, the people who are living on that situation, they can see that kind of the star, but all the people cannot see. In the similar kind of the things, the pulses are there, but the pulses are the very critical and rare pulses also is there. In my whole life I can't see, but I can see, but I can't understand what is that kind of the pulse when I see that. So then what could be the solution? How we can predict and do? This will be impacted to on the next class. So we'll try to learn how this will be. Right. Hollow pulse is there. Hollow pulse is the empty pulse. Some people having the drastic thing, like pulses beats are very rapid. Pulse beats are very rapid, but at the same time inside is nothing. The person is walking and coming at the age of 70 years, at the age of 60 years, the weight is 120 kgs, 130 kgs, 150 kgs. Now amazing, you can see that how energy within him. But the pulses are showing is the rapid and accelerated. Accelerated means is the more pulse. Pop-upping pulse. So that pulse is there, but inside there is everything is hollow. There is a pipe, blood vessel or pulse is nothing but is the one tube. How the needle guiding tube is there, so like that there is a tube. So that tube inside there is a popping, but there is no chi. The chi is not promoting to the blood, which is causing the stagnation or the emptiness. The blood is enough, blood is not pushing to the blood vessels to reach the destination. But that's the reason sometimes it shows reflecting. बोलते हैं ना, इतना मोटा है लेकिन अंदर पूरा फोखल. You push one hand, he will fall. But not all the people. Boxing and all, don't make him to stand, then I'll be in trouble, right? So the people, some of the people, they do have, there is no energy, but they have the, much more, weight is more. In this way, hollow pulses you can see. But that time you cannot predict that it is the more energy. Then the tympanic pulse is the character, is the large hollow taut and giving the feeling of the surface of the drum being touched. So this is some kind of the hollow pulse which is related to the, the scallion stalk or the softness of the blood vessel. So where the blood is deficiency and the essence is exhausted for the chronic diseases. Always you remember, when the blood should be thoroughly processed inside the blood system, there are the 3 major organs which to be incorporated to blood flow in our blood system. One is the lungs, the second one is the heart, third one is the liver. You protect these 3 organs that will support to other organs. If this is not passing and pushing the blood to the downwards direction and upward direction, only one major organ, the heart, is pumping the blood to the across the body. When the aorta is the good, then our head also good. Then from the heart downwards direction, all the organs also good. That's the reason it says is the monarch for all the organs is heart. The king of the all the organs are
Liver.
heart. Which one? Yes, brain also we can say is not wrong, right? Brain is dominating, right? Whatever you think and give the command, that works. But by the way, this the mind, at the same time is the dil. So this also supposed to the mind. If this not supporting mind, hardware and then software to work together to reflect something in front of you. Otherwise you cannot see the software until you can see the hardware, right? So therefore both are required. So heart is monarch or the king or the soldier to protect and to regulate the entire system of the body. So therefore the pressure is good in the heart, especially the aorta. When the aorta is pushing the blood downwards direction, and then the carotid arteries are taking the blood to the brain system, which we call as a ICA, internal carotid artery, which supplies to the brain system. When heart is not pushing downwards and then upward direction, then this carotid arteries get blockages. Then you understand this much is not functioning, then the entire body will be flaccid. Entire body will be paralysis. Right? So therefore you understand, always is the chronic diseases are causing the problem, is the blood is deficiency and then essence exhausted of the energy. Now the soft pulse is the baby soft pulse. How we can see the pulses like that, the pulses are there. So that to be considered for the babies are normal. For the adult having the very soft pulses, and where the chi is a deficiency, that means is the deficiency of the syndrome, and also the dampness is influencing is not good. When the spleen and the stomach, and then also the deficiency of the energy which are related to the soft pulse, we can see. That's the reason. What is the hard pulse? What is the soft pulse? What is the slow pulse? What is the rapid pulse? What is the irregular pulse? What is the knotted pulse? What is the round pulse? What is the taut pulse? So many pulses are different qualities are there. To understand all these things, what is required? Practice is required. Practice making the person perfect. Okay. Now the deep pulse. I'll try to wind up the class within few minutes. I think this motto is waiting for me to wind up, right? So now the deep pulse, you can see the deep pulse is very, very crucial pulse. When we wanted to see the deep pulse, that means is the Prakruti pulse. Vikruti, Prakruti. Vikruti means is the surface pulse. Prakruti, deeper pulse. So no doubt it is the nature also Prakruti. But however in the deeper level we understand. So we just give the pressure to the deeper level. We are trying to touch to the bone. That means is the radial bone. So radial bone you are touching. That means you can't reflect the pulse. You understand, this also is the key. Again I'll tell you in the practical section. The deep pulse you wanted to see surface pulse. You place the finger. Placing the finger itself is a feather touch. Placing the finger itself, feather touch. You shouldn't see the pulse, whether pulse is getting or not getting. That is your conclusion is, once you are not getting, then you just keep it in your mind. It's the hollow, empty pulse. Then you go to that middle pulse and then deep pulse. So middle pulse, okay. The deep pulse is we are pressing. Then you understand, are you getting the pulse? Are you not getting the pulse? If you are not, then you are deeply pressing to the bone. If you are pressing to the bone, that get disappear. Then slightly come upward direction to feel the amazing pulse. Then you understand which pulse is more, which pulse is deficiency. When the deficiency is there, excessiveness is there. If it is existing or there is a option, try to understand only two concepts rather than going for the 28, 32 different types of the pulses. But that will be dilemma or confusion to me, to you, to everyone. But initial stages, so without any confusion, try to see whether the pulse beat is there or not there. 10 beats minimum, you just see it is the regular rhythm is there, irregular rhythm is there, regular rate is there or irregular rate is there, regular strength is there, irregular strength is there, strength volume is correct, then the volume is incorrect. Try to find out these pulses, definitely you will get the answer. So once you go to the deeper level, that time particularly you can see the pulses is you are getting the pulse that indicating that particular organ pulse is absolutely normal. If you are not getting that pulse, indicating that is the abnormal pulse. That means there is the empty pulse, vacuity pulse, weak pulse, debility pulse or depleted pulse. There is no pulse. No pulse is also not indicating, be careful. If the pulse is not there, that also not indicating that organ is not functioning. If it is not functioning, how are you passing the urination? The spleen is not functioning, then how are you eating? If the heart pulse is not there, then how are you living? Everything is matters, but of course, at the same time, when the deep pulse is showing you or may not showing you, remember there is the barriers are there in our body system where it's not reaching precisely to the body system. That could be the reason to cause, but therefore there are the two solutions. I'll tell you, then I'll wind up the class. If there is all the pulses are there, one or two pulses are weak, that indicating that particularly those two organs are weak, then try to treat for that particular two organs. Then the pulses are, the person is okay, normal maximum level, but there is no pulses of the young pulses. That also to be, there is a reason, there is a barrier somewhere, and the deep pulses is not there, but the person is healthy normally, but at the same time there is the hidden pulse is there. The hidden pulse indicating somewhere the pulses are there, but that's not reflecting on the radial artery. So that particular time what to be done? Whether the dead body we can consider, there is no pulse indicating, or the person will going to die very immediately because there is no pulse. Normally when the person is very critical and doctor, my neighbor is really, we don't know whether he is living or no more, please come and check. So once we are going there, the pulses are very, very weak pulse, and after few minutes there is no pulse, indicating that yes, we declared that after seeing the pupil of the eye and then all the sensations, there is no stimuli is taken place, then we can consider yes, it is the dead. Right now he is passed away, he's reached his destination. Then in the same way we can see there is no pulse for the living body, he will going to die. Is it mean? Absolutely no. Right? That particular time you says no organs are functioning in your body. Does it say like this? Then where is the problem? Then the solution is, there are the few solutions. I just put a word and then I'll wind up. Then what to be done for the next? One is the ear points. I wanted to tell you. The ear point is the 0 point to be activated bilaterally. So both the sides there is a 0 point is there inside the ear. When I take the ear acupuncture, that time you come to know where is the ear 0 point. I think previous student knows that. So apply the 0 point together, both the ears, and try to see, you will find the yang pulses or the fu viscera you will get. When there is another pulse, deep pulses are not there. So that particular time the point to be known as a Chungwan, that is liver 13. Then Changmen. Changmen is the liver 13, Chungwan is the Ren 12. Both the points you just activate. Ren 12 and liver 13 and 0 point collectively will activate your internal organs. Wherever, because there is a junction. there is a junction or meeting point of the all the in viscera. The place is the Changmen, that is liver 13, where on the exactly on the lateral side of the abdomen, on the anterior side of the 11th intercostal rib, there is a point to be known as a liver 13. You just activate that point, then you feel there is the internal pulses are coming, the deep pulses are coming, the Zhang viscera or the in viscera is coming to the surface level of the artery. Then you can understand what pulse is deficiency, what pulse is excessiveness. Then you understand, then find out this is the way where exactly which organ now is the weakness. You shouldn't predict all the organs are weak. Then all the organs are weak, that is the terminal stages. But don't say, by the way, you will going to die very soon, right? The second thing is where the Fu viscera, when the stomach is not good, intestines are not good, triple warmer is not functioning that particular time, bladder is not good. So there is the one point where the meeting point of the all the organs, that is specific region to be known as a Chungwan, where the fortune proximal to the navel region and the central line, you just puncture and deeply that particular point without damaging to the viscera of the peritoneal cavity. Then you can find the solution. Then easily the yang pulses will reflect on the radial artery. So this to be practiced, analysis is very important. So once we analyze this, otherwise, sir, simply we can use all these three points together. When there is this the junction point, of course you can use it. 0 point using on the ear. The patient is known that pulse diagnosis, may know or may not know. That particular time you wanted to use the point, certainly you can use the point is the 0 point for the ears. At the same time, Chungwan, Ren 12 and liver 13 point also as a supplementary point to treat for the numerous diseases, known case of the disease, unknown case of the disease. Then you are focusing, because there is a junction point, how there is a Quan Yuan, that is a Ren 3, where the spleen, liver, kidney is the meeting point, and where the Sun Yang Low, that is the large intestine, small intestine, and then triple warmer is the meeting point. So similar way, this also meeting point is spleen, liver, kidney, heart, lungs. Meeting point is liver 13. So you just activate by these points, certainly having the great impact to treat for the known and unknown cases of the diseases. Thank you one and all. I'll wind up the class, and the people wanted to go far away. I know that people are waiting, Radhamma and then Vishwanath sir, right? So they came at 9:30 here. Thank you.